So what goes wrong with knees? We saw that beautiful surface.
Mm-hmm.
We're going to be looking more closely at this surface in a minute. What is it that happens to the surface? Because that is why joint replacement has to happen. We'll get to that. But what happens to those surfaces that go in the wrong direction?
Well, I use the analogy of a final common pathway to kind of explain a knee that's worn out. There are several things that can happen to the surface of a joint that, just as Eric was describing earlier, you can get these small scratches in the cartilage which begin the process of the knee wearing out. You can have, so this is that same knee, that perfectly glistening smooth cartilage that we saw earlier. A large chunk of the cartilage had actually separated from the end of the bone on this area, and so we're looking at that area now. An injury like this can actually predispose a person towards arthritis. So that's probably the first thing, the first cause, an injury to the cartilage which causes a defect or a hole there in that smooth surface. You can also have things like an infection where there's a bacteria that's attacking the cartilage. You can have an autoimmune condition like rheumatoid arthritis or psoriatic arthritis where your body is actually attacking the joint surface. You could have a trauma like a car accident and a broken leg that could fracture those bones and cause them to be like that porcelain cup, irregular. Or you could just age and it could wear out from use. Any one of these things starts a knee into the process of degeneration. And when you get to that final common pathway, you have an arthritic joint. The final common pathway, I just use a description or an analogy. If we were all going to drive to Washington, D.C. and go to the White House, we're all going to end up on Pennsylvania Avenue. That's the final common pathway, but we would probably all take different routes to get there. And that's the idea of the final common pathway. Your knee can wear out by many different ways, but when it's worn out, it looks about the same or pretty close to the same.
Okay, so maybe you can help us understand an example. Well, let's back up. The one we were just looking at, this is an early situation where they've got hope for some recovery, and it's, as a child, that's probably going to be a little weak in the future and susceptible, but they're going to be fine for many years.
Yes, exactly. By final common pathway, let's fast forward 50 or 60 years
for this child.
And look at this, for this child, and look at this knee that we're going to see on this next picture that you have. So once a knee starts to wear out, there's a couple of things that you'll notice. Thanks, Eric. When you look at the end of a femur, and this is what we're doing here on this in this picture, basically, if you can imagine a knee standing in front of you here like this. In this case, it would be a left knee with this model. We've just moved the kneecap out to the side, and we're looking at the end of the femur like this, just facing out towards us. So that's what you see here, the end of the femur. A couple things I want to point out. First of all, you can see the articular cartilage. That's this whitish material on this side, but you can see a huge defect on the outer side of the femoral condyle. Here, this light purple area is actually eburnated bone. That term refers to bone with no cartilage on it. The hard outer shell of the bone, the cortex, has actually been disrupted here. So you have actually raw trabecular bone beneath the cortical bone right here. This light pink margin that you can see all the way around, these are osteophytes or bone spurs that have formed around the knee to help the body distribute force, but they also limit motion and they're painful.
So on my left there, that looks a little reminiscent of the nice cartilage that we saw, but looks a little uncomfortable. On the right, it looks very uncomfortable. What would this person have been experiencing? So
this is a very common type of knee to see, and so you can, and what you're referring to there is the difference in wear on the two joint surfaces. So someone with this pattern, you get a little hint. Here's the kneecap. Okay, so this is a right knee that we're looking at right now. Here's the end of the femur, and on the lateral side and on the medial side. So this person is experiencing the majority of the wear on the medial side of their knee joint. And that is a varus type knee or a bow-legged knee that you're looking at here.
And is why is that happening? In other words, what you're saying is they're beginning to put more pressure on the inside than on the outside. Is it the way they're walking? Is it because of the defect that starts, just kind of spirals downward? What
So
causes that?
There's a couple things that can cause a knee to wear out in the structural, if you will, alignment of the joint. And I think a large contributor of that is genetic, but then also the things that you do for your lifestyle can contribute, as well as a trauma or a kind of an injury can contribute. So let me kind of use an example of that. There's really, the knees wear out in two different ways. You've got, on one hand, becoming bow-legged, like a cowboy, and on the other hand, you become kind of knock-kneed. And as that pathway starts, more force gets passed through the joint. Either also on a bow-legged knee, it's more through the inner side. On a valgus or knock-kneed knee, it's more on the outer side of the knee joint. And then what happens is that as that joint space narrows, more force gets transmitted through that joint, which then causes the wear to speed up, which causes it to accentuate it even further, and this deformity worsens on itself.